Okay. Let's see what
So
they
I believe they've given me all of the templates, and I can like see them. It's just more like um when do you use one of the macros versus what's already like available?
Yep.
Or,
I
as
can
a
I
part
can
of it.
I can show you that.
Yeah.
So this is just a basic page. Now, just first of all, like every patient is going to be a new patient for you. Okay, that's the biggest problem with doing these.
Hmm.
Okay, so that's the biggest struggle. So in my hands, my staff always does the HPI stuff. So they pull that in for me.
Hmm.
Um, my staff does the review of systems. So the only thing I do is, or not even me anymore, my scribe does the physical exam. So let's go into this. Okay.
Yeah.
So with a physical exam, if you click here, you're going to have something called saved findings, and then you're going to have previous physical exams, and then you're going to have templates. Those are the main three that I use.
Okay.
If you click on saved findings, it pulls in all the different saved findings. Saved findings are different than templates. You may not have saved findings, and I'll explain why. Saved findings are taking the content from the template and putting in normal values. So you probably only have templates. You don't have the saved findings, and I can teach you how to do that afterwards. Okay.
Okay.
Now, I'll start with the templates because that's going to be easier. Okay. So the main templates that I use, and just so you know, it's usually my staff that are picking the templates. Okay.
Hmm.
So based on what the patient comes in for, they're picking the templates. If I could do it over again, Miles, what I would have done is I would have done one master template
Okay.
and had everything kind of turned off, meaning hidden in that master template. The way I did it, is the main one I use is foot pain, and then I add things onto that. So I'll add on nails and calluses, I'll add on range of motion, I'll add on balance, I'll add on wound only, I'll add on wart and lesion only. So if I could do it over again, I would include all those little templates into a master template, which I don't have. So um, I don't want to confuse you, but I'll tell you what I'm currently doing, okay?
Yeah.
So let's say I pull in foot pain. You can see foot pain has nothing on there. So the reason you have to add in the saved findings is because every time you pull up foot pain, it'll pull in like this, and then you're going to have to pull in normal dorsalis pedis, no edema, no
Hmm.
varicosities, and you're going to have to click through and put all the normal values in. Whereas if you have foot pain normal, it's going to pull in all the normal values.
Hmm.
Make sense?
Yeah.
The way you do that is you do that in the settings file, and I'm going to write a note just so I can show you where you do that at again for later on. Okay. Does
Excellent.
that make sense?
And then you can add another like
So,
nail
yep.
calluses.
So let's say for most foot pain, let's say it's plantar fasciitis. So what I tend to do is limited range of motion and equinus bilaterally. They have pain, plantar medial heel, and then I double click here and I paste it over here. Okay. Maybe they have pes planus. Okay. And that's about it. Procedures. There's a lot of different procedures in there, but let's say I'm going to do a couple of the procedures you can do. You can do injection of tendon sheath. You can do EPAT combo, things like that. Okay. And all those procedures should be within the procedures. And they should
Okay.
have these little opening things where you can choose what side you're doing and things like that. Okay. Does
Hmm.
that make sense?
Yeah. And then
Now, if
do
you
those at
want,
all pull in CPT codes?
yes, they do. You have to make sure they're linked, and I can show you how to do that as well.
Okay.
Now, I have a lot of, you probably watched some of my videos on YouTube. They explain it there, but I can try to show it to you here. Okay.
Okay. If you have the can just show me the right video, then I can
Yeah.
watch
Now
that too.
let's say you want to add another template in here. So you have foot pain, but they say, oh, by the way, doc, I have some nail issues. I would add in nails and calluses. This is what I mean about like adding it into a master note. So everything's in here. So you can just turn it off and it only shows up when you click it. If I could do it over again, I would do a one master note. So this
Mhm.
would have hyperkeratosis. So I would add in present and wherever they're at. Let's say it's the first met head and like lateral fifth digit. Get in my calluses. Then the nails, the way I do with nails is we have to say which ones are thickened, like fungal. So I'll like do 1, 3, and 5, and then all 10 here. And I always click all these to get so I can say which ones are thickened. Okay.
Yeah.
And that's how I do the nails. And then this would have to correlate to my nail debridement and to my keratoma 2 to 4. So then you would go down there and you would do, I think I don't know what I think with bilateral, or I put like, I don't remember what I put there, right? First met head and left, I don't know, IBJ hallux or something like that. And they put those two and they have to match what's in your physical exam. Same thing with these. So this one, let's say it's first, third, and fifth, and all on the other foot. And I have to pick all of those so we know which ones are thickened. Okay, if it's 6 to 10. If it's 1 to 5, it's a different one. There's a different procedure code. Like I have 1 to 5, and I have tons of procedure codes, like closed fracture, matrixectomy, foreign body, everything else in there. Okay.
Hmm.
And then let's say there is like the main ones I'm adding on are that. Those are the nails and calluses, and the other one I add on occasionally is like a wound. I made a couple. I don't know if you have this wound only one. It's a new one I made because I'm starting to do collagen now and I have to be a little more detailed. So
Hmm.
there's a wound, which would be this one. So wound, let's say diabetic foot wound, the pre-debridement length, or is like, let's say 1 by 1 by 1. It's all centimeters, so it'd be like a 0.3 by 0.3 by 0.3. You could do a post measurement, dermis subcutaneous,
Hmm.
full thickness. And this is so I can get my collagen stuff covered. Okay. Color.
One is wound only.
Yeah, this is called the wound only one. You might have not, you might have, I don't know if you have this one. Undermining, no. Necrosis, no. Infection, no. Location, I always put in here. And then when it began, I like this because when I'm doing future notes, we always forget how long we've been treating these ulcers. And
Okay.
so like
Yeah.
I can look, oh, it's been 6 months. So that's all that. I fill that out. And then here in the procedure, I'm going to do ulcer. Actually, it's called debridement. So debridement, is it skin, muscle, or bone? Most of mine are skin or muscle, depending. Let's say it's doing this one. And then I have to put in here, it's going to be, let's say, the right first met head. I did a scalpel and tissue nipper, hyperkeratotic ring, devitalized tissue, subcutaneous, how many, like it's 1 square centimeter. And I'm doing wet to dry betadine, things like that. Okay. So
Great.
those are the main physical exam templates that I'm using. There are tons of other ones. Occasionally, like yearly, I'll do a CDFE. So I'll pull in. Now, the reason I would pull in a CDFE is not so much it's changing the note much. It's more just so it's recognized up on top, so I know I'm doing it annually. So it shows up differently in the note for when I'm scheduling. It's more for my reminder, so I can charge them a level 3 office visit for a CDFE once a year.
Okay.
Physical exam. What else can I show you?
Um, do now say one time I saw them their calluses and then the next time it's not there. How, how do you remove things?
Yep. So normally what we do is if you want to pull in, let's say it's new from old. So let's get rid of these things and say someone they're a follow-up appointment. Okay.
Hmm.
And you want to remove things. So you would pull in a previous appointment. So this one, here's some toe pain ones.
Hmm.
Um,
Oh, and it
there's,
has the date.
yeah, it has the date. So let's say this is the routine care that they were seeing before. That doesn't have anything in it, but like these is a practice patient. Okay, this has some stuff in here. And to remove stuff, you would just open it and you would change it. Whatever needs to be changed. You can pull in the new from old. Okay? and you would just change it based on that previous exam. So you can pull in the previous exams whenever they're in there. But in the beginning, there's no previous exams.
Hmm.
So the key is to do the saved findings. Okay.
All right. Yeah. Um, and then when do you use some of the macros, I
Okay.
guess?
So this is the physical exam. You have to learn all of my procedures. All the procedures are in here that I do. Orthotic scanning, all these EPAT, foreign body removal, everything you pretty much need should be in here. If it like AFO dispensing notes, you know, everything, casting, non-weight bearing, all that's in there. Okay. So let's go over to where you're talking is more in the assessment and plan.
mhm.
So we have to choose the assessments. So you have to kind of choose what you're doing. And what normally happens, there's something called order sets, which I'm not sure if you have my order sets. Order sets are a combination of diagnosis and order at the same time. So, for example, order set would be for a posterior night splint, okay,
Mhm.
or other types of things. Um, and there's different types of orders, okay. So you can make these order sets, and you'll learn about this later on. But there's like heel pain complete, which pulls in plantar fasciitis, naproxen, shoe modifications, and physical therapy prescriptions. You can make up whatever your own order sets are based on what you do. I don't use order sets as much anymore. I just pull in what I need. So within the diagnosis, then you can pull in what you're doing for that patient. So for example, I do a lot of meloxicam these days. So I'll put in meloxicam. I'm going to do a night splint, posterior heel splint. And then this one, you have to, put in the prescription information and stuff like that. One cool tip is when you're doing surgery, I sometimes pre-fill these out and I can change the date when they're going to get it. So
Mhm.
for example, let's say I'm doing Lamisil and they got 30 pills left and they're going to get another prescription in 30 days. I can post date this for 30 days. And so I can still get up to a level 4 visit because I'm doing the prescription that day.
Okay.
Night splints, you can either dispense it in your office or prescribe it. So for example, I can't do certain AFOs. I have to send them to Hanger. So I prescribe those and I have to actually pull in a provider. And so you put in the providers and they have most providers in here. If not all the providers are in there. So I usually send them to Hanger. But if the provider isn't in there, what you have to do is you hit provider and add a new provider and you just go and fill that out. Okay. And then it'll pull it in.
Okay. And then
It
that's
has
fax.
it's faxes over there. Like I have my quantum shoes, they send them up for shoes, Hanger, and it does it based on what you're doing. Like if it's DME, it'll pull my frequent DME providers. If it's pharmacy thing, they'll pull my frequent provider for pharmacies.
Hmm.
Okay. That's for the assessment and plan. So I have a lot of different things that I do. So for like night splint, they tend to have Aquinas as well. So I'm going to be putting that in there, bilateral. And then with the Aquinas, it's going to automatically offer for me to do let's say I'm going to do an orthotic, say I'm going to do an x-ray, and let's say I'm going to do like a night splint in there. So it's going to have a lot of these things already in there. Okay.
And then so they're listed under Aquinas diagnosis only.
No,
Uh,
that you can search for them anywhere, but
mm,
it gets to know what you do, kind of like AI.
okay.
So it has orders for Aquinas contracture. There's like 20 of them in there.
Hmm.
Okay.
Okay.
And they do these automatic. So that's that. There's tons of orders. I can go over more in detail. Like if you tell me a specific patient, hey Don, do a note for this type of a condition, I'll do it for you.
Okay.
Now you wanted to get to the macros. Now macros is the pain in the butt. That's why I have Morali. He actually might be listening to me right now. I'm gonna mute him. So okay. So this is so you're gonna do, let's say Amy, that's her name. There's presents. Presents new Ben and presents Ben. So this is Ben, one of my colleagues that's put this up.
Yeah.
Presents new is a 50-year-old female, presents, returns, or returns for a new complaint. They present.
Hmm.
When you hit present, you have to click off of here. Okay. Because if you don't do that, it'll like delete it. If you start like typing it and you click the wrong one, it'll delete it. So you always remember you go to these things and you have to click somewhere else and you've finished typing. And then this talks about what level time you spent with them with the straightforward, low, moderate.
Okay.
and then they're going to return at so much of a time. So that's that portion of it. And then what you in between here, you do the dot codes. Now, if you ever see the dot codes aren't showing up, do you see that they're not showing up? It's
Hmm.
because this was a template. So sometimes with these templates, you have to it messes it up. So you have to actually delete the bottom part, and then it'll show up. Now there's tons of these are called the dot codes. There's tons of these. So these can be used for everything. But the most common ones I use are like for like, let's say plantar fasciitis. It'll
Hmm.
pull in my whole, where to go here? Pulled in everything here. There it is. So for plantar fasciitis, it pulls in my whole discussion. So we talked about it, what they're going to do to reduce inflammation. And what I do with these ones is whatever they're not doing, I'll either delete, like if they're not going to do shockwave, I might write at the back of it, I might say, we'll consider in the future.
Hmm.
Compression sleeve, they're not going to do, or we didn't talk about, I'll just delete it. Deep tissue massage, physical therapies. You can make your own and modify mine.
Yeah.
But this is everything that I need. Now, what Ben does when he makes these is he adds .equine, .dme, .peg, and .new at the bottom of it. And what that means is you click here and it'll .equinus, since you can document the equinus, if it's like gastroaxolial, if it's bilateral, and what they're going to be doing for it. And then .dme is when we're giving out DME, you have to put in what they're getting. They're going to get a night splint. They're going to get it on the right. And this is a shod or a non-shod. So this is a non-shod device. And PEG is the thing that we use for teaching our patients and sending out information. I spent 10 minutes
Hmm.
going over it. And then .new is the decision making for a new patient. Okay, that's a master one. Now, this is an advanced concept, this one right here.
Yeah.
Okay, you
Yeah.
can go back and review that, showing you simpler, like there are different things for anything that you can think of. So what I would recommend is I would go into Athena and I would go down to here into this my internet's slow, maybe because I'm talking to you on it right now. I would go in to look at all the macros and edit them according to what you want to do,
Yeah.
how you do things differently, like edit the macro codes. So I want to show you. So you go to clinicals, that's where you spend most of your time, is under clinicals. And I did it quick only because I didn't want to show my patients' names. Okay. So
Hmm.
what you're going to do down here, there's a couple of things. What I use the most, let's go through these. There's procedure templates. That's what I showed you. There's physical exam templates. Okay. And there's text macros. So physical exam templates are the ones, and I can show you how to edit them, but those are the templates for like foot pain normal, things like that. Procedures are all
Yeah.
those procedures. Okay. And then the macros are this thing. Now they did an improvement on macros recently where you can actually search for the macros. And so these are all the macros, and you can go through and see who has access, what's in there. You can see kind of how I make them so they can fill in, so you can learn how to do that. But these are all the
Hmm.
macros that you'll have access to, and you can search for them. And so you can kind of go through and read
Yeah.
how to do that with the macros. And then the other thing, there's as you go down here, I don't do these forms, order configuration. So these are the order sets that you have to set up, like physical therapy prescription.
It's all set in six.
6, okay. So you can add a diagnosis and then like terbinafine, so you can add an order set. So Lamisil adult, custom orthotics, Lamisil booster, physical therapy, ibuprofen, surgery medications, the ibuprofen, Visceral, Percocet. So these are all things like gout medications. So these are called order sets.
Yeah.
And then if you go down here, order delegations, that's something important because you have to delegate to your staff so they can order prescriptions for you.
Hmm.
And then order type and procedure mapping. This is charge integration. You asked about like when you order a procedure. So these are all the procedures and these are all the
Hmm.
codes that go with them. So when I do a velocity brace, it knows it's a L1906. When I do an aspiration of assist, it knows it's a 20612. So so when I put in the procedure, it automatically pulls this into the billing tab. I don't know if yours are connected. I don't know if it does it automatically or you have to connect them. Okay, but
Yeah.
all these are in my EMR resources. Actually, I have all these copied and pasted in there. So if you want to see how to connect them, okay.
Great.
Um,
I think that
Raleigh, if you
that's
could
really
just mute
helpful
this.
just
If you
to
could
see
mute
how
your-
you use the
Raleigh, could you just mute your mic, please? Okay, I'm sorry. Go ahead.
oh that's just good to see that. Okay, you really just use the macros in the discussion, and that's
Yep,
for what the patient
yep, that's the
sees.
only place you use it. You could do it in patient instructions. I don't do patient instructions, but you could anywhere you start typing dot, whatever. And you can, if you do one that you really like and you want to save it, you just click this and you can make your own right then. Like if you're going to repeat something multiple times, you'll call it a name. And then
Mhm.
and you can do it in that section only or other sections. But you can use dot codes like if you're reviewing like lab results that come in and you want to have a canned spiel, you can do that. Like for example, physical therapy or MRI results, I'll go over it with the patient comes in the office or things like that.
Okay. And then when you're all done, you generate um like a note that the patient sees.
Okay, so we're going
Is
through.
that
Here is where I send the letters. So I send letters to different doctors. This is really easy to do, real important to do for every patient.
yeah.
Just want to show you quick. This is the billing tab. And so I put in billing stuff right here. The codes, I'll add them in. I have a biller that checks my stuff. I put in notes if I want the staff, if I like do a cash pay ultrasound, I'll write that in there. Another real cool feature is this chat thing, so we can chat amongst each other. Okay, I use that all the time
Mhm.
with my staff. And then in terms of a note, they can look at the note. Once you save it, then they can look at the note and that can go to the portal
Mhm.
or they can print it out. But once you're done, then it'll go to the portal. But yeah, they'll see the full note. If you want to see what it'll look like, you do full encounter, and this is kind of what it would look like right now. It has in all the medications, it pulls in their vaccines, it pulls in this social history, it pulls in the physical exam, and this is the same thing that goes to the doctor. So for example, if I pick out a doctor right here and I add it, you'll also see what the note would look like to them.
Okay.
You can view what it looks like going to the doctor, and you can even edit it if you want, but it'll pull up like a PDF example of what that letter will be like. It has the doctor's signature on there, and it has an example of the note.
Okay.
Okay. What
Excellent.
else? Hope this
Um,
is helping.
oh, really helpful. The HPI, are some of those templated as well?
Yeah, so for HPI, let me go back over there. They are templated. So you can see here, I have templates. There's foot pain, ingrown,
Mhm.
routine, fungal nails. You may have to make your own templates, like post-op follow-up, bunion. So you can make them based on the condition. Like here's
Yeah.
routine care. It'll pull in there in HPI. But a lot of these, the reason for the HPI is the HPI is usually connected to the physical exam template.
Does it? Okay.
So it usually populates other things. If you're doing like foot pain, like it doesn't have much for the API, but what it does is and then so the HPI doesn't do much except it populates other things that are kind of interconnected. The review
Okay.
of systems as well. There's usually a brief review of systems that pulls in there with normal values. For the history of HPI is I don't usually mess with that much here. Let me see here. It's up here. Reason for visit, encounter. So encounter plans triggers templates and orders. So this is something you might want to learn later on. Encounter plans are like, it's like if you do the same thing over and over and over again. So for
Mhm.
example, here, if they come in for me and the reason for the visit is ingrown toenail, it sets a diagnosis of ingrown and paronychia. The HPI is of an ingrown, physical exam is of an ingrown, procedure, puts it in there, review systems, pulls in the diagnoses, and that puts in the actual text macros. That can all be done. So whatever you're seeing, you're gonna have to set these things up. Okay, like plantar
Mhm.
fasciitis, it's gonna pull in heel pain, foot pain, template, physical exam, review systems, education. It'll have the X-rays. and things like that. So we have these for everything that we do here, but you can see they're not used a ton. Ingrown has done a ton, but if we were more savvy, but you can see how many times it's been used. It's not always
Yeah.
used because the staff isn't picking it right up. So these are more advanced techniques. Those are called, you saw where it was in here.
Encounter.
Counter plans.
Yeah.
Yeah, I don't usually use these other things. There's text macros. We did that. Test interpretation templates, procedure templates we did. HPI templates. So there are some HPI templates. I don't really like my staff does these things. I don't really do these, but there are HPI templates and stuff like that.
Okay. Excellent. Oh, maybe real quick, you put in X-ray. Where do you do an X-ray read? Is that in the physical exam?
Yeah, so these are under I don't remember when I made these. I made these a long time ago. I certainly hope you have access to mine. But where you put it in is under assessment and plan. So let's say, so within these, you're going to have both X-ray findings. So these are called point of care tests.
Mm-hmm.
So you're going to have ultrasounds, and you're going to have X-ray. So X-ray, we have two of the heel, three of the foot, two of the foot, three of the ankle, and two of the ankle. Normally for foot, we do two of the foot and two of the heel. So you have two of foot and two of heel. And they
Yeah.
pull right in here. So ultrasound, it has my template, and you have to pick, like you're doing the right side, initial imaging, and then you're going to have heel imaging in the fascia. You're going to talk about we did it long and short access. There's an effusion. It's thickening of 6 millimeters and stuff like that. So that's all in my template under ultrasound. And that's the ultrasound read. Same thing with X-rays. It's the same thing. I'm usually doing these at the point of care versus sending them out. And then it'll have my template. And this is something I made up. You have to choose right. Usually I pick these three are normal, and then you put in everything. So you have to learn how to use mine, but they're normal. Usually there might be a plantar heel spur. Now, if there's a plantar heel spur, like a lot of these, if it's not correct, yeah, if you have to like double click and put in the information. Okay, there's other things I sometimes have to double click for. Okay. Foreign body, mockingbird calcinosis, like everything is in here. And you can edit your own. I can teach you how to edit these, but these are everything. I don't use these fracture things that much. I spend most of my time right here and right here. And if it's a fracture, I'll just double click fracture, but the other fractures I just write in here. Okay. And then for post-operative x-rays show no change in fixation, position, and osteotomy. That's for like a bunion post-op. You have
Yeah.
IM angles and things like that. That's how you document it right in here. And then when you're done, you hit discussed with patient.
Excellent. And that's in
We're in the
under orders.
assessment and plan under orders.
Okay.
Yep.
Okay. Got it. Excellent. I think that that really gets me there. I was just like making sure, this is where everything goes.
Yeah, well, you pulled my stuff over, but I don't know if these advanced things are set up, like the integration between the code and that procedure.
Yeah.
And, I don't know if those things are set up. So what you can do is you can do a little like screen capture, like a Loom thing, and send me a link, and I can kind of help you walk you through if you need help.
Yeah. Excellent. Yeah, let me look and see how those things are linked. And yeah, if I need a little more help, I'll let you know.